medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
Welcome to part 2 about fatigue. In this particular episode, we're going to talk about the diagnostics that you need to do, as we talked about the etiology last time. So one of the things that you're going to have to do are comprehensive labs to determine where that person's fatigue is. And remember, it may not be coming just from one source. Doing a thyroid profile doesn't mean just a TSH, but the free T3, the free T4, TPO, and antithyroid globulin. Inflammatory markers like CRP, high-sensitive C-reactive protein, ferritin, interleukin-1B, IL-6, tumor necrosis factor. Hormones, get all 7 of the hormones to be able to determine, including the anabolic hormones of DHEA and pregnenolone. In metabolism, the fasting blood sugar and the hemoglobin A1C. Kidney and liver function should be examined, as well as the adrenals. AM cortisol and the 4-point saliva would be perfect. In autoimmune area, ANA, reflex to type and pattern would make sense. Homocysteine, looking at fibrinogen for blood viscosity as well. In microbial testing, Lyme and EBV. Cancer markers like CEA and PSA, CA2729, etc. Toxic metal should also be examined. And look at the CDSA for your gut health as complete digestive stool analysis. And make sure you also get a good evaluation of the autonomic nervous system. Also be able to give you lots of information. B vitamins like CoQ10, anything that can basically reduce adenosine triphosphate would be important. And someone who you believe has chronic anxiety or psychological issues, well, a psychological eval would make sense as well. Sleep study, if that may be the issue, certainly looking at things like midday cause of fatigue, the number 1, which we talked about, which is water depletion. Evaluate how much water the patient drinks. Get allergy testing for both inhalants and foods, which will give you an idea as to whether the number 1 constitutional symptom of allergy is in play, which happens to be fatigue, of course. And evaluate mitochondrial function, like using certain mitochondrial tests, like cardiolipin, IgG, IgM, and IgG, which are the inner membrane of the mitochondria. So there's a lot of tests I just threw at you. And the most important thing is you listen to this several times, become overly familiar with these different lab tests, both blood, urine, and saliva. Their addition to your armamentarium is going to make sure that you find the cause and the etiology of someone that is fatigued. And also remember, in-office testing by T-bars, which is the sine qua non for finding MDA abnormalities or malaldehyde, suggesting a significant reactive oxygen species in play. Now again, as I said at the very beginning, the important thing to remember is it may not just be one thing, and treating only monotherapy in one area is a sure way you'll have failure clinically, but looking for as many of the potential issues and correcting them simultaneously is going to give you the best outcome possible. I'm Dr. Mitch Ghen. Thank you, and you have a wonderful day.